Hello and welcome to the Financial Planning for Canadian Business Owners. I'm your host, Jason Pereira, and today on the show, I have Steve McEwen of My HSA. I brought Steve on the show today to talk about defined contribution benefits programs, specifically better known as health spending accounts in Canada. So let's get started. Steve, thanks for taking the time today. So, Steve McEwen of My HSA, tell us about what it is you do.
Hello, listeners. Thanks for having me, Jason. Happy to be here. So what we do at My HSA is we basically built a turnkey platform for advisors only. So we don't go direct to the end clients. And basically what the platform does and the services that we do is all things spending accounts. So I love that you term it the name defined contribution, because that's probably a better terminology, because there can be lots of different names and these accounts are used in different ways. But basically, um, that anything that an employer wants to reimburse for expenses, either some are taxable, some are non-taxable, can be done through the platform. Um, and we're completely bootstrapped. So it was just myself and my business partner at that time, Tim Kane, and decided we needed a solution for ourselves, started to build it out, and then kind of quickly, other advisors started asking us about using the platform. And that's kind of when the light bulb went off. So not just employee benefit advisors, but financial advisors, life advisors, um, anyone who basically had a business client was a good kind of advisor to use the platform.
Okay. So let's talk about how these contrast to traditional benefits programs. So traditional benefits programs, people are pretty familiar with them. You have an insurance carrier and you submit claims and there might be a deductible. There's a reimbursement percentage that happens with them. And there's limits on a lot of benefits, specifically around paramedical. I can't go to the chiropractor an infinite number of times. I can't get an infinite number of massages. I basically have those limits. Talk to me about how defined contribution or health spending account programs differ from traditional benefits programs if they're used as a substitute, because they can also be used as an add-on. So let's talk about the substitute first.
Exactly. Yeah. So typically how it's used. So CRA has a list of eligible expense items. That list is actually the same list that you have available as a medical expense tax credit. So the METC list. So wisely, they said, okay, you can have employers, you can have and reimburse off the same list. So that makes it easy. And then the employer can essentially just give the employee a set dollar amount. Let's say it's $500 or $1,000. And that employee can go out and claim anything that's on the list. The list would cover everything that you would think is in a traditional plan, but probably include some things that aren't included in a traditional plan. And it's as simple as that. So you give the employee $500 and they can go spend it on the dentist, eye exams, and a massage, all in one spot. And it's defined contribution. So basically, the employee has $500 to spend and the employer's never out more than 500. Traditional plans operate a little bit more under like the insurance model, where there's a premium and every year you're going to renew it based on claim activity. Um, so it can be a little bit of a roller coaster for the renewals on the insurance plans, where this is kind of dollar certainty on what the expense will be. So that's kind of for a small business owner. That's a lot of times what's appealing to these. And then the employees on the flip side, different employees will have different needs. So they just get a lump sum amount and they can spend it as they see fit. It's not so much regimented X amount on physio, there's no dental, etc.
Yeah. So, I mean, back to the traditional term, which we can term to be defined benefit. The benefits are clearly defined as to what you get. And there's an insurance factor that, if the entire pool spends more money than the insurance company was planning on, well, that unfortunately, that employer is going to see a higher renewal. So you have that. And what you're saying is that this functions like a special bank account that effectively allows people to spend on whatever they please, right? So that's so let's talk about that. So $500, 1,000, whatever the employer says they're willing to spend. But it doesn't have to end there, right? Like we can also put in place other insurance benefits within this to like protect people in the event of big exposures to health and medicine.
Yeah. So, and this is probably one of the most uncommon. I'm wondering because it's like common to us and our advisors, but it's still probably relatively uncommon. Is you can pay for catastrophic hospitalization plans, is what CRA says. So basically, you can pay for a catastrophic drug plan in a health spending account. So, and again, when I was an advisor, I could sell any type of plan. So typically, if a client or a company wanted to still have the assurance of insurance, meaning there's some comfort in it where if it's catastrophic, their financial needs are met, totally fine. You can go buy a plan, so like a personal insurance plan. So one that you would see with Manulife, Blue Cross would have one. Those premiums are actually eligible to be run through a health spending account. And then a lot of providers, just like we do, they'll offer a catastrophic insurance above and beyond the health spending account. So travel would be an example, or high cost drugs would be an example. Because there's a need for insurance. Like we've always come into the industry saying we truly believe insurance, but for most traditional plans for health and dental, that's not insurance. So like if you think of it like a home insurance policy, you don't go insure your toaster because it's not a high enough dollar amount. You'll see vision, for example, being taken out of the traditional and just self-insuring it through this model because you can only spend $250 typically a year in most plans. So you're not at, no one's at a big financial loss. So you actually don't need insurance for that. The employer just needs to reimburse it and have it set up,
Yeah.
with some sort of structure.
Yeah. I mean, effectively, it makes sense. What you're doing is you have something that can be used as a spending account, but then you can layer on insurance. And what you're doing there is that insurance is going to be a lot cheaper, right? Because what you're really doing is you're creating a high deductible policy, a very high deductible policy, right? It could be, I don't know what the minimums are, but I typically see around 1,500 to 2,000. So if the insurance company is not basically swallowing dollar one, the cost of providing that catastrophic insurance, so that high cost insurance is a lot lower, right?
And honestly, if you look, and again, this is getting into the weeds in the employee benefit space, but that's literally what, even with an insurance company, that's what they do. And it's a concept with insurance, like on the property and casualty side, they call this like captives, where they just kind of layer the insurance, and it just makes a lot of sense depending on where your risk tolerance is.
Yeah. So makes perfect sense. So, I mean, effectively what you're doing with that kind of model is you're basically saying, here, do whatever, so model one, just all you guys a spending account. Employer's going to basically do X and have it paid for. Now, one important point I want to make here is I've come across employers who basically make this mistake often. A lot of times employers will sometimes, because they don't know, will say, you know what, I'm not going to do it back. This plan's too expensive, but just bring me the receipt and I'll reimburse you for your expense. Can you explain why that is not something they should be doing?
Yeah, like, and they get, and usually like, because you come across it all the time, and once you just sit down and like walk them through it, and we've got resources on it, like they quickly realize why that's like just probably not a great idea. So, um, again, you have an employer-employee relationship. The minute you're basically handing over like private medical receipts. And I always use the analogy. So there's two problems. One is that you see the information, which could be used against you as an employer. If maybe they really stink at their job and you have to fire them in 2 months, now you've seen some information that they could or want to try and use against you. But and I almost think the more important issue with it is that they probably have medical expenses that they would love to get reimbursed, but they don't want you to see it. So they're not putting in their psychiatrist, receipts. They're not giving you all of their actual eligible medical receipts because they don't want you to see it. So having that kind of third party processing system, it just makes a lot of sense. And then there is some debate that you actually need a third party to process it. But honestly, there's large companies that do it. And I think you're technically, from CRA's perspective, allowed to do it, but it just makes no sense. And the other reason why it wouldn't make a lot of sense is the cost of these things, like whether it's with us or anyone, is so low to get access to a platform processing the claims experience for the employees good. You've got customer support, the movement of money's clean. So for accounting purposes, um, and then because we only use advisors, we would argue that you get the system for this small cost, but you also get that advisor's expertise. So again, we just do the spending account, but many advisors will have expertise in all group benefits. Maybe they do some pension, whether it's a financial planner where that's their expertise. So they can provide value in tons of other areas, as well as advise you on the spending account. So it's and I mean, we charge, it's just a percentage of claim on what is claimed. So typically you'll see 10%, no
Okay,
setup
let's
fees,
hold on.
no
But again,
annual.
the entire going back to the why you wouldn't want to do the reimbursement. It's again, it's a privacy issue, potential violation of your privacy, depending on how you look at it. And I'm not clear exactly on what the legality of it is, but it does expose both sides, right? Now, I also want to talk about kind of the third way to do it, which is basically as an add-on to a traditional group plan, right? So you may have a traditional group plan that basically has deductibles and things that are not covered, and people will complain about things that are not covered. But I mean, if an employer's willing to, they can always throw one of these on top as a supplement to everything else.
Totally. So like, for example, a small business will very rarely have orthodontics, but anyone who has kids at a certain age, like those costs can be huge. So one option they can do is you might have a traditional plan that might cover basic and major dental. And then again, orthodontics is super expensive. So you might not want to give them, you can certainly add a health spending account that can be used for that type of coverage. The other thing is vision. A lot of vision plans won't cover employees for the full amount for glasses. Like we both wear glasses. They're much more expensive than a typical plan covers. And then two, what happens with vision, if you don't have glasses, then you're essentially paying for coverage for the employees that do have it. The nice thing about a spending account, if it's in a top up manner, is those that need the vision can use it there. And then say you've got needs for chiropractor, you can use it there. So it's kind of like a good catch-all, especially as a top up, to let the employees use it where they see fit. Traditional, it's very regimented, where this can be very open-ended, but you can narrow it down to specific items if you want. So that's kind of been a unique thing, where basically you can cover just orthodontics if you want, or you can cover just vision if you want, or you can go down to maybe where we're really starting to see some interesting things in the DEI space is like specific buckets of money for specific areas of interest from employers. So the ability, because like you said, defined contribution means you can just split up a defined contributions for whatever needs you need. And then you can actually just figure out, is that a non-taxable expense or a taxable one? Because we also do, and others now in the industry do a taxable thing. So that can be gym memberships, pet insurance, like basically anything the employer is
Let's be
really
clear
passionate
though.
about.
So it's interesting. I get that. Now, I will say this much about those employee kind of like spending accounts in that regard. If they're not health related, then that, as you said, is a taxable benefit to the employee. So they
Yeah,
may spend $100 on the gym, but that $100 is going to show up as a benefit on their plan. It's like, that's the same thing as just giving them a raise, right? Like now, don't get me wrong. There's a psychological aspect to saying, oh, my employer covers all of this, but brass tacks, it's window dressing. Now,
totally.
that makes people happy and it's a behavioral aspect, fine. But when it comes down to numbers, that stuff is just the same thing as straight comp.
I could not agree more and could not disagree more with the actual like value of them because again, so the story I always tell people, so when I first started in the industry, Um, we did a health spending account in house, paper based. It was total garbage. Like it was terrible. That's kind of like why we built the platform. And I had a large client who we were doing the health spending account for them.
Mhm.
It was a large home builder. And I was in their office one day for a renewal and they said, we do a wellness spending account. You guys do a health spending account. Mechanically, it looks like the same thing. Can't you do it? And I come back from accounting and I said, we could do it. I could charge
But
you, but it makes zero sense. You can just track this all on the spreadsheet. And they said, well, the cost is not huge. And same, they don't want to deal with um, every employee bringing receipts to them. And what happens on a wellness spending account is they start to go, well, Sally's yoga got covered, but Johnny wants his bike covered. So they can't just set
yeah,
up a
look,
plan and do
outsourcing
it.
the admin, I get it. But, I remember I did have an employee once come to us say, "Hey, you know you can do this?" I'm like, "Yeah, do you know that that's the same thing as taxable income? And that basically, if I just give you that raise, it's the same thing."
If you give them $200, they will not value it as much as you buying or supporting a bunch of. I totally agree because like the math makes sense, but
Yeah, I get
there's
it.
way
It's a
more value
psychological
creation.
issue. Also, it was also an insurance aspect that if they don't spend it, then they don't get that pay versus the actual pay. And the other thing too, the only thing I don't like with that, and I'm going to get on my soapbox on this one, is when individuals make choices to, because some of these programs will allow you to allocate one to the other. Like, hey, you have $1,000, allocate between them both. And people think of the immediate cost as opposed to the medical concern, which may happen. And next thing you know, they've blown it all on the gym and personal training, and then they have a medical event. And now they're like, oh boy, like I could have really used that for that. Now you can make the argument that's money and money, it's equal dollars, forget the tax implications. But I think, we had to, at some level, there's a bit of a paternalistic side to insurance when it comes for your employees. And sometimes you need to structure things in a way that prevents them from blowing in the wrong things.
I totally agree with that. It's too bad that it's literally a CRA issue because like we get that argument all the time is like, well, how do I know what I should put in my wellness account versus my spending account? Because I don't know if I'm going to get in a car accident. And we say like, totally makes sense, but it's a CRA, like you have to allocate. But that's where I do think you're limited on business size and budget. This is where I think the argument would be the best solution is you can be paternalistic and actually have insurance where you need it. Like something like disability insurance, like the best disability insurance is one that never actually needed. So you're paying a lot of money for something, but you really don't ever want to need it. Ideally, with a good advisor, they can pick and choose where they want to be paternalistic. And then with these more flexible accounts, it's kind of like this is where they get to check some of the boxes for employees, which is extremely hard because you have multi generationals in the workforce. Like
Yeah.
an older generation might enjoy the traditional plans, but the younger they look at a traditional plan, a younger generation, and go, so if you're not doing like a flex or wellness style stuff, you're missing this whole target, and they do like it.
Yeah, and I get it. And again, it's the entire, they just want to feel like they're getting something of value as opposed to something they're never going to use. Talk about, I cut you off earlier. Let's go in and talk about what it
Yeah.
costs to do something like this. So you charge an administration fee of 10%, correct?
Yeah, like just like any other kind of business, I'd say you can do it a bunch of ways, and people in our industry do it a bunch of ways. Majority of providers do it like us, where you just pay
Yep.
a percentage, an admin fee on what is claimed. Some people will charge a setup fee. Some
Mhm.
people will charge a renewal fee. Ours is just a fee on claim.
I've seen different
Yeah.
models, but the market clearing price around this seems to be somewhere around 10% for administrative charges.
Yeah.
Yeah.
And you might see different, like, so if it's more tech heavy, you're going to be like 10%. If it's low, like there is still some paper providers that will do
Yeah.
it like as low as 5. Um, the odd time you've seen a couple tech companies try kind of a SaaS, like a per employee per month model. Pretty rare in the space, I'd
Yeah.
say.
So you have that model, but then advisor compensation, that there's also taxes on this, right? So there's premium tax on this. There's provincial sales tax on this, despite the fact provincial sales tax got integrated to HST. This did not. So all said and done, like what's the typical range all in that you typically see, it end up costing an employer across Canada?
definitely changes because like here in Alberta, you would just have the 10%
Mm.
plus the 5%, but it's only on the admin fee. And in Ontario, it's completely like there's an RST that's charged on the claim amount.
Yeah.
And so, you'll range from like, again, your admin fees typically 10%, and then your taxes on top of that can be, I'd say from 5 to 15 would be the average, I guess, with Ontario is the highest.
Right. So I think it's, and I think it's important. I'm bringing this up in particular because, I see a lot of people say it's, oh, it's just 10%. No, it's 10% plus plus. And by the time you work it
Mhm.
out, let's just be straight. You're absolutely telling the truth. It's 10%. And, it's about full disclosure. So,
Totally.
and frankly, people may say, well, hold on, 20 cents on the dollar. That seems like a bit much, but it really isn't when we do the math on basically what this means is after tax. Right. So, I mean, if I was to basically pay someone money that they would then use to pay for medical needs and medical purposes, it would go to their marginal tax rate. And that marginal tax rate, unless you're at the lowest tax rate imaginable or making next to nothing below the lowest marginal tax rate at the exemption amount, odds are that there is a savings there to the end user.
We've had that conversation hundreds of times with advisors kind of saying like, oof, especially in Ontario, they're like, oh, oof, that's like a heavy tax hit. And we said, we agree and do the math, have the accountant do the math. And they still come out there like, yeah, it's not as good, but it's still an advantage.
Compared to top bracket, it's like a 30% delta, right?
Yeah. And then too, like, because I think a lot of advisors compare to the medical exempt tax credit.
Mhm.
And even that one, because it's not like an HSA, if you think about it, it's like first dollar, where that one is a percentage of income. So it
And the
just
more you make, the
basically
harder
the
it is
math.
that so it's got to be a big claim relative to your income. And, people are like, oh, I'll just write this off of my tax. Like, no, you don't need to work with a calculator. It really is not a great tax
Yeah.
credit, right? It's one that's there for borderline catastrophic cases as opposed to everyday stuff.
Yeah. So it's depending on the situation on the advantage of it. There is an advantage in almost every case, but it can vary and it's something to look at for sure. They're there.
Okay. So let's talk next about how these things get set up. You typically work through advisors, and advisors are the channel that all benefits gets. So advisor goes to a client, goes to a business and wants to talk about what are they doing with the client to design this program?
So basically what they do is, um, they'll basically talk to the client and see where our situation will make sense. And like I said, we're used in like a million different ways, which is the right way, I believe. Because again, I believe in insurance. I'm still licensed. Like I believe in insurance. So we'll see it used in different ways. So typically a small business with not a big budget, we're a good starter plan. If you're a one person corporation, but full disclosure there, you have to be very aware of the shareholders rules. Um, and then as you start to get into larger size employers, you'll see it used in different ways. So a lot of the times we're used in that top up scenario where you've got a base plan and then we're just a layer on top. As you start to get into a little bit bigger, say like 10 employees or more, then you might see us as a top up plan or used as a flex plan where they allocate between the HSA and wellness. And then the really large groups were being used for the wellness spending account. So insurance companies do HSAs. But a certain size, there is some ease in just using the insurance company's HSAs. There's nothing to hide from it. We still win a lot of business, so it's fine. But then at the very large group, that's where will you be used as a WSA or even an HSA because they like the product and the platform so much that they can swap out insurance companies, but keep the HSA or WSA constant. And then even at the larger group as well, too, that's where we kind of have like a defined ASO style where you can start to create lump sums of money for employees for specific things. So, like vision only, we call that My ASO, where you basically can just define exactly lump sum amounts. And so there's a little bit more structure to it. What they do is figure out the need, and create the plan administrator. There's no paper. Um, we do enrollment where it's just an email and then the employees go in, log in on the app or online.
Yeah. Let's
The
talk about the
plan's
employee
already set up.
experience.
They're all
We'll
good.
go to in a sec. Let's talk about the actual employer. So at the end of the day, the employer, what you're really describing here is an incredibly flexible plan that permits the employer to either just say, here's a pot of money, knock yourself out, or to work with an advisor to put some best practices in around silos, right? Like let's
Yep,
allocate X to Y and this amount to whatever and make it structured and make it look and taste and feel a little bit more like a traditional plan. And this was actually
totally.
an interesting protest I've had before. It's, I remember one highly competitive field where they're like, where we're looking at the options and they said, well, God, I can't look at this because last thing I need to do is spend time explaining on, yes, we have a benefits program, but it's different than the one you're used to and whatever else. If you can make these things very, very similar, you don't have to have that conversation. Yeah.
Yeah, and that's where the flex, like, so that's where the lump sum amount is the easiest to do because employees will log in and it's a flat dollar amount and then they can figure out what's eligible. And that's where a lot of the industry insurance companies, I think, have missed the mark. So what we have is really big adoption where our customer support on the app is interacting with the end employee because the problem with benefits, it's always been there, it's still there. They're extremely hard to explain to every employee and every employee understand what's in their benefits package. Like you get a booklet this big and then you're like, this is great, here you go. And no one wants to read what is an insurance contract. Um, so that's where we flipped it over where we can directly deal with the plan administrator and the employee. And that's been a huge advantage where we're like, employer and even to an extent the advisor, just send them in to us and we've got real people on chat and now we leverage AI big time and we can educate. So a lot of the times our employees are coming in but they're just like, hey, is this allowable? Hey, tell me about like, what is this plan? What can I do with it? And that's where we can educate them in kind of like normal human speak. Um, and it's been super valuable for us because that's where we get a lot of the loyal advisors, plan administrators, and employees is that once they're in the environment, we can kind of like treat them what I would say is almost like a normal tech company approach where it's like, let's just simplify this stuff. Like benefits is too complicated. We know it is. So
Mm.
that's where I think so it's different levels, right? You can go super easy where you're like, just give them a flat dollar amount and cover everything, but you're limited, like you are limited. Um, or you can go that siloed approach.
Right. So then let's go back to the end user experience, right? So we're basically talking about they get an email to enroll, they go through a process, and the claims process is all done via apps, or how do you typically handle this?
Yeah, only apps. We don't do paper. So that's the one thing we've kind of, and again, that's like the business model where, tech company, we knew we wanted to scale. So we couldn't have phone centers and we couldn't have paper claims coming in the mail. So they log in, simple setup. It's very simple. If you've got a flat dollar amount for HSA and WSA, then there it is. And then you just go into the same spot to claim. If you have siloed benefits, then it will just be broken out, whatever that's been um, labeled as. And then they go put in a claim. And then we've got a combination of OCR bots and humans that are
Mhm.
double checking and some redundancies there. So if it's above a certain dollar amount, then humans will get eyes on it. And then we do the withdrawal from the company. So the plan admin and all the reporting's it's online available, but we also just send it via email, much like you would an Amazon receipt. Like it's nice that it comes to a plan administrator. It comes in an email so you can just save it for accounting purposes. And we do the pull from the company account, claims plus admin fees plus taxes. And on the same day, directly deposit to the employee's personal account. So that happens twice a week now. We can ramp that up if we needed to, but that's kind of the cadence that seems to work.
And it's not different than a lot of the traditional insurance programs now in terms of how they basically experience the user, right? They have apps. You basically take a picture. And as for your claims adjudication process, it makes perfect sense. You've got tech tools, trying to take humans out of the loop, because frankly, most of this stuff tends to be routine for most people, right? Someone who's a diabetic who goes and buys it every month from the same pharmacy, does it really need someone to look at that every time? Or is there a better technological way to do that to help keep your costs where they are? So it makes perfect sense.
Yeah. And now the big thing that we're seeing, and it's happening in the industry, is fraud, right? Like, so,
Oh boy.
um,
Yeah.
people doctoring receipts and stuff like that. So that's again where we're leveraging outside AI platforms that can deal with fraud, because it's getting pretty wild everywhere.
There's been some very big charges dropped against actual, like, very large employers and many in the public realm as well that basically experienced a traumatic amount of fraud. So yeah, not surprised. So, all right, to wrap it up, basically, when do you think people should consider a defined contribution plan over traditional benefits plan, as a kind of closing note?
I think you basically, if you own your own corporation, you should have the conversation with your advisor. Um, Even if you are a small business owner, you should at least have a traditional plan, but the business owner should have a plan set up as a top up. So you can do different classes and things like that. So it's worth a conversation with your advisor to see where it would fit. But in most cases, it makes sense in some capacity, whether you're small or large. But don't discount insurance, like I said.
Absolutely. So, where can people find you if they want to look into it more?
So our website's www.getmyhsa.com. And again, I'm big on LinkedIn if you want to get a hold of me. Super active there. So yeah, those are probably the two best spots.
So if you enjoyed this podcast, please review on all the usual podcast spots. That would be Apple Podcasts, SoundCloud, Spotify, or now on YouTube. Enjoy and take care.